Hello, welcome to Whiteboard with MERHI in 3 minutes. Today we're going to talk about a topic that's extremely common, and it is overweight and IVF. Overweight is a problem throughout the United States and all over the world, and 2/3 of women in the United States are overweight. But a lot of those patients, they go to fertility clinics and they are being denied either egg freezing or IVF just based on their weight. And they've been told that you need to go lose weight, come back in 6 months to 1 year. In some centers, they're recommending them to have surgical weight loss or bariatric surgery. Well, let's talk about Sandra. Sandra is a little overweight. She went to multiple clinics and she was told, we cannot do IVF on you or egg freezing. And she was told, you need to go away 6 months to a year and potentially undergo surgical weight loss. Well, here's the thing, there's multiple problems here right now. Number one is, according to the American Society for Reproductive Medicine, the ASRM, no woman in the United States should be denied IVF based on her weight. 2, we all know the complications of being overweight, which is heart disease and diabetes and all that stuff, which it's common sense that we're all aware of them and we have to avoid them. However, waiting 6 months to 1 year, guess what? Now Sandra, her AMH, which is the marker of ovarian reserve, is much lower, number one. So right now she has much lower chances of getting pregnancy, lower number of eggs, and because she's a year older, now the quality of the eggs also declined. But guess what? Also surgical weight loss, even though it helps with the weight loss, dramatic weight loss, but a lot of studies showed that it actually could be harmful for the quality of the egg, especially in the first 3 months, because the malabsorption of all the nutrients can affect negatively the quality of the eggs. So instead, what we do here, instead of putting Sandra under IV sedation to do egg retrieval, we do them first under local anesthesia. So this way, there is no risks of being under general anesthesia. So that's a plus, and I recommend this could be done in other centers as well. 2 is freeze the eggs here. You don't have to get Sandra pregnant right now. Freeze the eggs or embryos, put them in the freezer, lose weight, and then put them back in. And this way, Sandra and the doctor and her eggs and everyone is going to be extremely, extremely happy.